All right, so what we're going to do now is we're just going to demonstrate total body energetics on a muscle. It can be a muscle anywhere from the head down. We're going to do the cranium by itself. So remember what we told you. The first thing you want to do is calibrate. So you're going to say, show me a yes, show me a no, make sure that you're online. And then it's going to be permission to learn. Permission to balance a muscle anywhere in the body. So below this. So we got permission, yes, we have permission to learn. So the first thing I need to do is, this is a workshop and we're intending to work with muscles. We've got to find out where that muscle is. So we're going to leave the cranium out for now. So is the muscle in the anterior torso? No. Is it posterior torso? No. Is it upper extremities? No. Is it lower extremities? Yes. So it's that quick. And I've already identified which one it was, right? It's the right psoas. So you can use your intuition. So we know that it's the lower extremities. So if you were going to navigate, you would ask, is it the left leg? No. Is it the right leg? Yes. So we know it's a muscle anywhere in this right leg. But we have muscles in the front of the leg, all the quadriceps, sartorius, we have the adductors, all the muscles we reviewed, the tensor fasciae lata on the outside, the glutes in the back, piriformis, hamstrings, calf, all those things. So you can quickly say, well, is it a muscle on the inside here? No. Is it a muscle on the outside? No. Is it a muscle on the back? No. Is it a muscle somewhere in the front? Yes. So we have a lot of areas. We have muscles down here, we have muscles here, we have muscles coming in from here. Is it a muscle down in this area? No. Is it a muscle in this area? No. Is it a muscle in here? Yes. So it's something going on here. So here we have your rectus abdominalis. Is it rectus abdominalis? No. We do have some quadricep muscles that are coming in here. Is it a quadricep muscle? No. Maybe it's a high adductor muscle. No. Is it something deeper? Yes. Is it the psoas? Yes. Okay, so we have the psoas muscle on this side. So once we've identified it's the psoas muscle, we want to evaluate. How do we evaluate? ARTS. A-R-T-S. So A stands for asymmetry. So make sure you can see. What I'm going to do is I'm going to place my hands on the front of his pelvis. What do you see?
Elevation.
See, this is higher, isn't it? So he's like this. So there's an asymmetry there. R stands for range of motion. So if you lie on this side, I'm going to come back like this and notice that he does not move at all. Want to check that?
Yeah. Sure does.
Now,
Don't worry, it won't.
can you lie with your head at this end?
Sure.
Yeah, spin around. Let's check his good side. Look at the difference. Come on over here and feel us.
One day both of these will do this.
Now, roll on your stomach for a minute, just for a sec. Yep, face down. Good, there's good. Remember that your psoas comes from the lumbar spine, doesn't it? Well, take a look at his spine here. Look at the asymmetry here. Look at my thumbs.
Oh, wow. Yeah.
Look at that. He's asymmetrical. And then he stops right there. So he's all posterior on this right side, so he's asymmetrical. If you lie on your side and face me, I can also do, a tension test here. So I can feel, and right there he's stuck. See? Right there precisely he doesn't move. Want to feel that? So that's the key area, but check below and above it. You can support the front of his body here. Use the heel of your hand. Okay? So you're just going to be pushing there, and you're just going to do a spring test. You can feel the tension there. So he's got a lot of tension there. I can also check range of motion here. I can flex his hip. Look at the extension. He doesn't have any extension there. Look at the rotation. There's no rotation. Look at this. No movement there at all. Come up here and just feel. Try to rotate it. There's no movement there. Okay. All right, you're going to lie on your back, head at this end. So we just did lots of different evaluations. Why do we evaluate? To learn, to show change. So we know it's the psoas muscle. And what we're going to do is we're going to treat this muscle, but we need some more information. We're going to skip step number 2, where the emotions, consciousness, things like that. We're going to go to step number 3. is step number 3 a priority? No. Step number 3 is all about positioning. So we don't have to worry about that. What I'm going to do now is in step number 4, we're going to practice doing hold space. And so we're going to create an alignment or put our hands on that particular muscle. So his psoas inserts here in the lessotuberosity. So what I'm going to do is I'm going to take the hologram of this psoas out. I'm going to place it here. I'm going to place a hand here and a hand here. So this is the hold space. And what you're going to be doing is you're going to be gently tapping with your left hand over the heart. Yeah, and just breathing in nice and easy. So the activating force that we're going to give you from this is rhythmic stretch. So we're going to tell you exactly what to do, because this is a workshop, and then we'll be able to go from there. So hold space, my hands are here, they're not moving, they're just creating an energy field around this hologram. I'm feeling a huge shift in between my hands. There it is. So it's starting to go now, starting to go, and there it goes. There's the rhythmic stretch. You relax. And now I'm going to integrate. We're going to tap out the 3 brains, breathing in and out. So I wait for the shift. It just shifted. Breathe in. That just shifted. Breathe in. And that just shifted. All right, so let's reevaluate. Take a look at this now. Look at the asymmetry. There is no asymmetry. Okay, so that's better. Can you lie on this side? Take a look at this psoas muscle. Look at that now. So you have a feel.
It's gotta feel better to him too.
Yes.
Yeah,
Yeah.
look at that.
Okay, you can lie on your stomach, head at this end, just like we did before. So let's take a look at his spine. Look at his spine now, guys.
Oh, wow.
Completely symmetrical. See? That's symmetrical. Lie on this side. So it blows me away when you do this energy work and it changes structure. Let's take a look here. Look at this. That's all loose now. How it feel? No tension there. So we evaluate his spine. See, look at this. That's pretty good. Look at this. This didn't move at all before. You feel that? Good. So that's how simple it is. That's a hold space technique with rhythmic stretch for psoas muscle.